Hi class. In this lecture, we will discuss drugs used to treat thromboembolic. So let's start this discussion off by reviewing hemostasis. Hemostasis refers to the finely regulated process of maintaining fluidity of the blood, repairing vascular injury, and limiting blood loss, while avoiding vessel occlusion and inadequate perfusion of vital organs. We're going to focus on the aspects of hemostasis that relate to stopping bleeding. So there are essentially two steps in this process. First of all, formation of the platelet plug. And the platelet plug formation begins by some type of vascular injury. So platelet aggregation will be activated or initiated when platelets come into contact with collagen, which is exposed on the surface of a damaged blood vessel. So in response to that collagen contact, platelets begin to adhere to the site of the damaged vessel, and this results in massive platelet aggregation. These aggregated platelets constitute a plug, and that's what stops bleeding. But that plug is unstable, and it must be reinforced with fibrin in order for that protection to be long lasting. And so that's where stage 2 comes in. Stage 2 is actual coagulation. So in stage 2, really the focus up here is production of fibrin. And fibrin is just a thread-like protein that serves to reinforce that platelet plug. And fibrin is produced by two convergent pathways. And so these are referred to the intrinsic pathway and the extrinsic pathway. They have other names as well. Those are the kind of the traditional names that have been around for a while. So these two pathways have some individual steps, but then they converge at some point. And ultimately, they have a kind of self-sustaining, self-reinforcing amplification of the coagulation process. So if you guys want to read more about these individual pathways, you can do so in your textbook, pages 594 to 597. For our purposes, just understanding that you've got some kind of vascular injury that leads to a platelet plug and ultimately coagulation, which is essentially supported by fibrin. I think for our purposes that is sufficient for an understanding for these drugs that we're going to talk about. Now, ultimately, we become concerned when we have inappropriate clot formation because number one, that could block your vessel, or that clot could break off and embolize to a distant vessel and cause problems. In your textbook on page 596, you can take a look at the two different pathways, the intrinsic and the extrinsic pathways. And this diagram I like because it highlights which factors in those pathways can be inhibited by which drugs. So two of the most important anticoagulants that we'll talk about are warfarin and heparin. And so in this diagram you can see all of the factors in green are inhibited by warfarin, and those factors in yellow are inhibited by heparin. All right, so before I talk about fibrinolysis, I just want to mention the body does have a protective mechanism against widespread clotting. And so those clotting factors that might stray away from the site of that particular vessel injury, those are actually inactivated by a physiologic molecule called antithrombin. And one of our drugs that we'll talk about, heparin, which I've already mentioned, this drug works by accentuating the effects of antithrombin. Now, the body also has a process for removing the clot once healing occurs. And so the body accomplishes this with plasmin. Plasmin is an enzyme that degrades the fibrin meshwork of the clot. And plasmin is produced through the activation of its precursor molecule called plasminogen. And I mention this because we'll talk about a class of drugs called thrombolytics, and these drugs actually work by promoting the conversion of plasminogen to plasmin. And it's ultimately plasmin that degrades that fibrin clot into its degradation products. So a thrombus is a blood clot. It's formed within a blood vessel, or it could be within the heart. Thrombosis is actually a pathologic functioning of the hemostatic mechanisms. So something's gone wrong. Now, your blood clots can occur either as arterial blood clots or arterial thromboses, or venous. The arterial thrombosis occur when platelets adhere to the arterial wall, the artery gets occluded, and then there's lack of perfusion. Venous clots, on the other hand, occur because of slow blood flow. So the stagnation within that vessel initiates the coagulation pathway, or the coagulation cascade. And then the reason why venous clots can be so concerning is because, well, one, they could occlude the vessel, but even more concerning, or as concerning, is that that clot can break off and then travel to other parts of the body and cause a blockade in some other vessel, usually smaller vessels. And so this is of major concern. So the venous clots that we are concerned about, deep venous thrombosis, so some of the subjective symptoms that suggest a DVT would be leg pain or tenderness, leg swelling, warmth, redness, palpable cord. They're usually unilateral, so as you can see in this picture, this patient has a DVT, and you can see that one leg is much more swollen than the other. As I mentioned, sometimes these clots break off and they travel to other parts of the body. The most concerning location, one of the most concerning locations, is a clot that travels up to the lungs. And so those are called pulmonary embolisms, or PE. So symptoms of PE: chest pain, back pain, shortness of breath, tachycardia, anxiety, hemoptysis, which is just coughing up blood. And then finally, the other type of venous clot that we get concerned about is thromboembolic stroke. And these actually could be either arterial clots or venous clots. So symptoms that suggest thromboembolic stroke: sudden or severe headache. Usually patients say, this is the worst headache I've ever had. Some vision changes, changes in speech, unilateral facial droop. And the patients that are at the highest risk of these type of clots are patients with atrial fibrillation. And so for that reason, many of those patients will receive either antiplatelet therapy or anticoagulation therapy.